The National Dairy Farm Program recommends 6 best practices when it comes to dairy farm management regarding training, standard operating procedures, and record keeping. First, your dairy must have a veterinarian client-patient relationship. That means that 1. The veterinarian has assumed responsibility for making clinical judgments regarding the health of the animals and the need for medical treatment, and the client has agreed to follow the veterinarian's instructions. 2. The veterinarian has sufficient knowledge of the animals to initiate at least a general or preliminary diagnosis of the medical condition, and that the veterinarian has recently seen and is personally acquainted with the keeping and care of the animals by virtue of an examination or by medically appropriate and timely visits. And 3. The veterinarian is readily available or has arranged for emergency coverage for follow-up evaluation in the event of adverse reactions or the failure of the treatment regimen. Take time to train and educate animal caretakers about animal care expectations and animal well-being policies. Thorough and regular training of employees is vital to exceptional on-farm animal care. Documentation of such training must exist as part of the National Dairy Farm Program. Describe the procedure to employees, train to the procedure, document the completion of the training, and monitor it over time. Make sure standard operating procedures are readily available and posted in the native languages of employees assigned animal care responsibilities when necessary. Although verbal directions are acceptable as long as all employees are conducting the protocol and procedure in the same manner, written standard operating procedures are preferred. The operation should have a herd health plan, as well as training and protocols for handling, transporting and caring, and euthanasia for cattle of all ages. The veterinarian or a trained consultant can help a producer establish a routine herd health plan. An emergency plan must be readily available to address animal care needs arising from unique circumstances such as a fire or natural disaster. A dairy should arrange for personnel or temporary help to cover emergencies, weekends, holidays, and unexpected absences of assigned caretakers. The owner or manager should make sure that personnel are informed of animal care expectations and qualified to perform assigned duties. To speed communications in an emergency, post the site address and the names and telephone numbers of emergency contacts, such as the herd manager, owner, and veterinarian, in a prominent place in the animal facility and in employees' native languages. While an emergency plan can be verbal, a written emergency plan is preferred for consistency in communication. When it comes to identification and record keeping, each animal must be permanently identified and an effective record-keeping system in place for animal care and management decision-making. Animal identification and record-keeping are critical for making important management decisions about feeding, grouping, selecting, medicating, breeding, and culling an animal from the herd. In addition, food safety, foreign animal disease threats, and bioagri-terrorism concerns make premise and individual animal identification a necessity. The U.S. Department of Agriculture recognizes the use of the official National Animal Identification System 840 RFID tags for the dairy animal for its lifetime. Every animal should be identified by a method that's permanent and easily read by caretakers. The National Dairy Farm Program recommends participating in the National Animal Identification System and using official 840 RFID ear tags. A specific milking routine, procedures, and actions must be followed to ensure cow comfort and well-being. When a dairy cow is frightened or excited or experiences pain, she releases hormones into the bloodstream that interfere with her milk letdown and reduce resistance to mastitis and other diseases. Therefore, a consistent routine for bringing cows and milking machines together is essential. Gates and restraining equipment should operate smoothly, quietly, and safely. Waiting time should be consistent for each milking. Generally, the time interval between initial udder stimulation to milking machine attachment should be between 45 to 90 seconds. The preparation routine that signals the beginning of milking should be pleasant to the cow and consistent. The routine should include checking for abnormal milk and thorough cleaning and drying of the teats. Teat ends should be inspected and scored frequently. Avoid medical examinations or unpleasant experiences from being associated with the place of milking. The milking facility, whether it's in stanchions or in a milking parlor, must have clean floors with good traction and proper illumination if it's to be hygienic and safe. Grooved floors will prevent the cow from slipping. The facility should be designed and operated to meet or exceed Grade A dairy standards. The pre-milking holding area on farms with milking parlors is the place of highest animal density on the farm, and as a result presents the greatest opportunity for injury. Consequently, it's important that prevention of injury be considered in the design of the holding area's flooring, space, sidewalls, and entrance to the milking parlor. Moderation of temperature extremes by use of fans, sprinklers, or other technology should be considered for holding areas and the milking parlor. Milking equipment should be regularly maintained and checked for vacuum level, pulsation rate, and pulsation ratio. Equipment should also be checked for stray voltage if unusual behavior is exhibited or milk production drops. Portable equipment should be maintained to grade A dairy standards of efficiency and sanitation. Equipment must be cleaned between milkings, and deposits of mineral, milk fat, and protein must be removed. Neglecting to wash equipment, even once, can cause the next shipment of milk to fail quality tests. Carefully review milk test results for any signs of improper equipment function.